People are spending more time than ever in front of computer screens and their phones and may think the strain is due to all that screen time, but it could be their vision is impaired. February is both National Age-Related Macular Degeneration and Low Vision Awareness Month, and our sponsor, Suburban Eye Care, can help. We are joined now by Dr. John Jacobi, the Clinical Director at Suburban Eye Care. Thank you for being with us.
Thank you, Tati. Good to be here.
It's great to have you. So let's get right into it. What is age-related macular degeneration?
So age-related macular degeneration is really a destruction of the center of our retinas, and therefore it steals away our ability to see very fine detail. We call it the 20/20 spot, and with its demise, then it's very difficult to do the things that we love to do, such as driving. You mentioned computers, hobbies, reading. We really tend to fall out of life, and as the disease progresses, it can really it can bring on some forms of depression and isolation too. I guess the best way to describe it is, Tati, if you take one hand, cover one eye, and take your fist and hold it right in front of your other eye, stare right into the fist, try not to look around it, and as you pull your fist away, look right into it, try to notice what's around the fist, and that's probably an early stage macular degeneration. As the disease advances, which it tends to, it's like bringing your fist in till it's almost touching your cheek.
Oh, wow.
Right? So that's how limited their vision becomes.
Wow. So how can a low vision doctor help? Because you got to seek help for this.
Oh, absolutely. So what we do is a couple things. First, we start out with a conversation, right? Our treatment's very task specific. We want to make sure we meet the needs of what the patient wants to accomplish. So we start out there, and then we move on to training them how to use that sight, that healthy retina that's around and still there. Then we add telescopic lenses, magnification, if you will. We prefer those kinds of glasses, and I have an example here. We prefer these kinds of glasses because what they do is they allow us to have our hands free to do what we'd like to do. These happen to be set for television and computer. Other ones are set for driving, and I think you've got one, like I said, you've got one of those there that I'd like you to try on here in a moment. But with the right magnification, with the right training, and with the right lighting, then we can accomplish our goals.
Okay, and you're right. I do have a pair here, which we'll get to in a second. But let's talk about what kind of eye conditions would someone see a low vision specialist for?
Well, because it's Macular Degeneration Awareness Month, I want to make sure to mention that again. But that's also the majority of our cases, probably 75%. It's become somewhat, I hate to say this term in these days, but somewhat epidemic. There's also diabetic retinopathy, glaucoma, and cataracts. There's also a juvenile form of macular degeneration called Stargardt's disease.
Oh, wow. So now we have images of patients wearing these, and like you said, even while driving. How can low vision glasses help?
Okay, so as you're looking at that patient picture there, what happens is they'll look down through the lower part of the glasses without that funny little device in front. That's the telescope. They'll look down there as they drive to see side-to-side peripheral vision, and then they tilt their chin down to spot, to pick out the color of a traffic light, the detail on a road sign, how close am I to the car in front of me so I know when to brake.
Okay, great. So now I'm going to put these on because we have a pair here, and
Sure.
the difference is, like you said, you can look down and you see one part, and then you look up and you see fine detail and things are closer. And it's easy to kind of like transition between the two different vision capabilities, if that makes sense. Am I saying that correctly, Doc?
Absolutely, absolutely. And that's part of the training when we learn how to drive with those. Other example, we do call them mobility glasses, not just driving glasses, because a lot of folks will go grocery shopping and can't quite spot down the aisle and see where they're at, or they can't find their loved ones when they're in the mall, or they can't see they can't watch the services, religious services when they attend.
All right, this is great information. Thank you so much for joining us.
Thanks for having me.
To learn more about how low vision and how Suburban Eye Care can help, and to schedule your appointment, visit the website suburbaneyecare.com and click on the low vision tab. Again, that's suburbaneyecare.com.